Payson.
And a big thank you to our KRIM Community Spotlight sponsor, Desert Financial Credit Union. Good morning, everyone. Chris Higgins filling in for Randy Roberson on our Community Spotlight program. Hopefully all of you are having a wonderful morning, and I don't know, there's probably others out there that are like me, a little disappointed that we didn't get more snow. I know there are others, though, that are very happy we didn't get more snow, but more is forecasted to be on the way. So hopefully, we get a little bit. The trees and the forest always love that. Well, this morning have a special guest, Dr. Alan Michaels with Ponderosa Family Care in the studio. Good morning, Dr. Michaels.
Good morning.
How are you doing this morning?
Doing well, yeah. We were actually running into snow issues in my own practice. We were trying to find a better balance, without having people come in from Pine Strawberry area and then 7 inches of snow predicted and traveling on the roads. And then we always have an issue with regard to people in our practice. We don't want patients, particularly the elderly, coming in and then slipping, falling, breaking a hip or a vertebrae. So we're always concerned about that. So we're happy about precipitation for the forest. On the other hand, the snow sometimes can bring special concerns.
Oh yeah, and it doesn't take much. I noticed this morning coming down my steps that they were a little slippery. There was, not much on the steps, but there was a little slush, and it's so easy, and it doesn't take much just to kind of have your feet go out from under you, and it's not good.
Yeah. Well, I appreciate you being careful.
Yeah, thank you. Again, with Dr. Alan Michaels, Ponderosa Family Care, I'm going to talk a little bit about COVID. We need to, and it's something that we're all dealing with, and the healthcare workers in our community and in pretty much all communities across the world are just faced, with a big challenge right now with COVID. And I know we wanted to recognize all of our healthcare workers, yourself, and all of your staff that are there, and really thank you for everything that you've been doing. I know me personally, I had COVID, and it was a phone call to you, and you were there and helped out tremendously with that. And there's so many people, whether it's for them or family members, that healthcare workers in our community have been there for us, and we can't say thank you enough for that.
No, absolutely. Yeah, we're glad to serve in that way. It's a challenging time. There's all kinds of different things coming at us with regard to COVID itself. We're seeing all kinds of variations of that. If you believe some of the virology labs around the country, they're seeing 1,200 variants. Omicron being one of the more recent concerns, and but there's all kinds of variations that are already happening, and so then it poses challenges with regard to, well, then how then do you treat that? As we come out with monoclonal antibodies, our hospital was the first to get that going, and just to mention, I'm chief of staff at Banner Payson Medical Center, and proud to be a part of that effort, and they have bent over backwards trying to help this community with regard to COVID care. We're now participating with the monoclonal antibodies as well. As the Delta variant started coming out, the recipe changed, and so they were able to keep up with the Delta variant. Now with Omicron having some 52 different proteins on the surface, that's going to be even different yet. And so we have to have an adaptable sort of a solution where we, bit by bit, we work on these sorts of things. Well, that means every healthcare practitioner out there is worried about, well, what variants do we see in our community? And how then do we best treat that? And so there's some general antiviral sorts of things can be done with vitamins and zinc and things, but much more specific therapy, if you really get sick and you have some increased risk factors, then you might want to get monoclonal antibodies. Well, now we have the concern of, was a monoclonal antibody, the recipe that currently is out, is that going to work against Omicron?
Gotcha.
Now, fortunately, what we've been seeing, and this has been studied, and Banner has been one of the aggressive people in our region studying this, is how much is actually still Delta variant, and the vast majority still is. I don't know our current percentage, but 2 or 3 weeks ago, it was considered over 99% was still Delta variant. But that's one of the big things about Omicron, is that it spreads fast. So with that comes all kinds of challenges then to the healthcare systems. We live in a great community. Our local hospital is sharing everything. They're sharing knowledge, they're sharing the treatment, they're trying all they can to try and help out where the emergency department is needed or admissions to the hospital. And they're handling the normal loads. So if a person has a bowel blockage, they're still handling those emergency surgeries. They're handling everything that they can. And last year, it was a little bit different where maybe they're handling more specifically just COVID care and saying, hey, unless you really truly have an emergency, don't even come. Well, now they're handling it all.
Yes.
And so that's a new layer of concern for the local hospital. And they've extended out a welcome hand, say, could you help with this? And as Ponderosa Family Care is a rural health clinic, then we've been able to work with government sources, get the monoclonal antibodies, and try and help with those efforts. And so you feel this collegiality with private practice and hospital like I haven't felt for a while. So I'm very pleased to be a part of that, that collective effort.
And that was a point you brought up before we started the show, was that, as you said, last year, the hospital was just really treating COVID patients, and they postponed all other treatments for the most part, non-life-threatening treatments, operations, and so on. But now those are back, and they're performing those, and then you also have the long-term COVID treatment.
Right, so
care.
there's a new weave to this. That's a good point. So there's all kinds of dynamics coming at the healthcare system right now, and then you have to consider, well, what does that do to the individual level? Where you're having vaccine mandates and all kinds of challenges along those lines, where you're trying to keep your patient population prepared, their individual immune systems ready should they encounter the virus. And as we were talking before too, that's a challenge in its own right. How then, a person never really knows, well, I contracted COVID, who could that be from? Well, it could just as easily be, just out and about in the public square, and could also be a contact that you have no idea.
And I think just looking at this, I don't recall, maybe, and you would know better, being in the healthcare industry, but a real push for preventative, for supplementing, for vitamins. That really has never been maybe the primary focus of our kind of medical model. It's, there's been treatment and wonderful, treatments and therapies, but as far as preventative, it's not maybe been as stressed as much as it could have been or should have been.
I
where
would
you're
say
seeing that now.
Certainly within the general public, that's true. Dr. Hunt and I would take issue with regard to, we've always tried to make things preventative.
Yes.
But even the healthcare system, if you reel the clock back 10 years, we had to trick the healthcare system in order to do preventative type of care for Medicare, Medicaid patients. And so there was a demand to do it. On the other hand, there wasn't the pay to do it. And so you're like, how could you have a healthcare system that's not really promoting that? And then this has brought that to the fore. I have never had a season where, as soon as we got flu shots, and I mean like August, September, we had people rushing in to get flu shots. And I've just, in our years of practice, we can't hardly give it away sometimes, but yet that's a preventative measure. And now people are hearing, oh my gosh, it's like the Farmer's Almanac. It's going to be a terrible flu year. I don't know how you can predict such things, but it is a good thing to have your immune system already ready as you can prepare it for whatever virus is coming around the world and then might spread to your area. And so the same thing with regard to COVID care. I think one of the best things that, we have a number of people that have had their antibodies tested, and when they don't find antibodies, they're kind of shocked. They say, oh man, I really thought I had COVID in October of 2019. And they had some sort of illness, and it sure sounded like COVID. But if you don't have antibodies, you're not well protected. Well, that's a great time to talk about, we could protect you. There are things that we could do with vaccinations and shots to try and help make your immune system ready for when you encounter disease.
And I don't know if you remember, but it was years ago when Fireside Espresso was here. And there was a period of time, let me see, when my son Noah was born, and I got real sick and just stayed sick for a month and tried so many different things, high doses of vitamin C and garlic and just a ton of stuff. And I'd get better for a little bit, then get bad again, get better, get bad again. And I remember I made an appointment, and I saw you and gave a antibiotic, which, you know, they're definitely, well, in this case, it proved that there was a need for the antibiotic, because right after that, it, you know, kicked it. But my immune system and what I was doing just wasn't able to do that. And it was a great example of, you sometimes people need that, sometimes they don't. Sometimes the vaccination, a shot, whatever it is, just to get past you know, that point, or get over that infection, virus, whatever it is.
Well, and then that shows a willingness on your part back then to say, well, okay, I'll do everything I can from a naturopathic viewpoint and optimizing my health. And those should be done, and we should practice those on a regular basis, you know. Now, we learned from echinacea in years past that if you constantly stimulate the immune system, eventually it relaxes and says, well, I have that stimulus all the time, I'm not going to respond this time. And so then we found, well, then a pulsatile fashion might help. With regard to prevention. And this is no different, you know, that there are different things, you know, the moment you start feeling some illness, get on some of those naturopathic things and try to boost your body's capabilities of fighting. Well, I look at that in just another extension of saying, well, there must have been a bacterial component of what you were facing back then, and at the appropriate time, you know, we've overdone antibiotics. We've created some resistance. So now we have programs at the hospital and in my practice of antibacterial stewardship. So antibiotics, you want to make sure you're not just throwing them at every virus where they don't help at all. 90% are, when we get illnesses, we find 90% of those are viruses. But a week or so later, maybe the phlegm is increasing, maybe the fevers are coming on again. Like, why? I thought I was kicking this thing, and then I had this new wave. Well, that's a great point to consider those antibiotics, okay? But that is secondary treatment. You're already into illness, okay? When you mention prevention, then we start saying, well, that's where vaccinations may be helpful. And, you know, there's all kinds of different dynamics, and I don't want to get caught up in the politics of all this sort of stuff. But, you know, if a person demonstrates they don't have immunity, that's a good time to consider those options.
And now you mentioned antibody testing. Where are places that people can get antibody testing in Payson currently?
So there's a whole variety of thoughts when you mention that. But Sonora Quest, actually, LabCorp. You know, we have laboratories that actually have the ability to send those specimens off, and run those tests. And so that would be a good way to kind of target, you know, gee, I'm not sure about this new vaccine. I'd like to have a little more time to consider and see the safety profiles for my particular conditions. And yet if we found that you didn't have any antibodies, that might influence your thinking about that. And should, actually. It should really influence your thinking. So, and if you get the antibody testing done and it shows a higher level or good level of antibodies, then you would want to consider or look at that in making that decision. On an individual level with your healthcare provider, you should you know, consider those sorts of things. You know, and in general, what we've been trying to do is get everybody vaccinated, so before you encounter disease, your immune system has some preparedness. And that's one of the things that's begins to edge in on, well, where do the controversies come up? Because you know, certainly if you have no immunity to it, you definitely want to get vaccinated. And if you don't have, or if you do have immunity to it, then you need to consider vaccination and do it a little differently. You know, there are countries in Europe, for example, that natural immunity, and if you just have antibodies present and a sufficient amount of antibodies, they consider you ready to fight that disease. Okay. Now, is it perfect? You have to consider the fact that, you know, when a germ hits your immune system, it may take your immune system 4 or 5 days to produce antibodies. Okay, so if it's already gone into memory mode and you have no circulating antibodies or very few, then you've got very few antibodies to fight this virus as it comes in. Okay, if you have a more robust antibody level, then it has at least a preparedness in your bloodstream ready to fight immediately when you encounter virus. Okay, well, what we learned with Delta was that the incubation period only took 2 days. So you might start developing symptoms before your immune system really started ramping up again. And that's a part of the purpose of saying, well, then get vaccinated in addition. Just make sure that you're staying on top of those antibody levels. And a lot of those things have not been clearly established. Well, how much antibody is enough? Well, it kind of depends on how much virus you encounter. And, if you get coughed directly into your face with a whole lot of virus, that might be different than, if you just had an incidental contact from, a public area.
Now, you also mentioned that a pill has been developed.
Yeah. So there's some new treatments that are oral, and Pfizer and Merck are the leaders in those sorts of things. And the one from Pfizer has emergency release for that. So they're trying another avenue to be ready to fight these things. And if you look backwards a little bit of time, then when we first encountered HIV, boy, we had nothing to fight it. Okay. And then along comes some antiviral drugs. So not antibacterial, but antiviral. So if you're sure you have HIV, right, you have a positive test, if you're sure you have that, then those sorts of treatments can be appropriate. And it's worked all the way to the point of, gee, I had an exposure I've learned about now, and then I have medicines that I can take right away to try and help me combat that. In that particular case, we weren't fortunate enough to have a vaccine that really worked out. Then it comes along hepatitis C treatments. Now we have a 99 or 95% cure rates of hepatitis C. And early in my practice, that was outrageous. You had all kinds of different therapies that were like chemotherapy, and it was like a cancer fight. And so we had all kinds of difficulties with that. Now we have amazing cure rates where we can't find any detectable virus in the system. Okay, along comes COVID, and now we have vaccines within 10 months. We have oral medications within 2 years. And just amazing innovations worldwide, and to a large degree, we have a lot of American innovators that are participating in worldwide platforms now, and creating antiviral medicines, again, an intracellular virus, antiviral medicines that can get in there and kill this stuff without a whole lot of side effects. And so I'm glad about the innovations. I don't know what sort of curveball Omicron is going to throw to that. But very thankful that we've continued on with the aggressive push in the medical arena.
Again, if you're just tuning in, talking with Dr. Alan Michaels with Ponderosa Family Care, and it's just so much information, so much information, and so much to this, and I cannot imagine you as a doctor and healthcare workers. The challenges that those things present. So
there's been so many great innovations. I'm so thankful for all that we've done. We've had community organizations like MHA Foundation, and we had our National Guard involved. We had the county health department.
Yes.
All kinds of people making huge efforts to try and keep our population safe. At one point, MHA, Ponderosa Family Care, and the efforts that we were making with vaccinations put us on CNN and New York Times for having vaccinated more of our population than any place in the country. Okay. Now, as we look backwards, it doesn't seem like such a big milestone, except we were trying all we could to help protect our population. There's still a lot of people that might consider this vaccination, and I find as I have private discussions with people, a lot of people still open to this idea. They wanted some degree of safety studies, and to a certain degree, it's been challenging with regard to different environments going to mandatory vaccines, and that's caused we were referring to before we got on the air about the Great Resignation, where there's all kinds of people, all kinds of dynamics changing the workplace and the economics in America, and a whole lot of people choosing to work from home and saying, well, I have this capability and I'm going to use it in any way I see, not for one particular employer per se. And so we're having all those kind of things develop as well. Well, that makes it really challenging as healthcare workers, where we have people with amazing skill sets, like some of my staff, amazing skill sets. Just think of what it would take to give a newborn baby injections.
Wow.
Right? So the kind of knowledge they need to have, and the ability to work with a child, even the fact that many are ladies in my practice, that have young children,
Mm-hmm.
and they don't want to poke a child. So there comes all these different stresses with that. Now you lay on top of that COVID. We're running out to cars in my practice, so we're putting roller skates on and coming, like a car hop.
Yeah.
Trying to provide care.
Yes.
Well, that then begins to put some wear and tear on a person now. It's
Mm-hmm.
wintertime, we're having snow, and we keep going out to cars. At some point, we're gonna have to change that model.
Mm-hmm.
And other practices, they bring their COVID patients in. It's just like another virus. And
Mm-hmm.
then they have some staff that maybe are exposed or get sick, just like we've had in my practice.
Mm-hmm.
And then other practices absolutely lock you out and say you can't enter unless you attest that you have none of these symptoms, and that sort of thing. We're trying to find that right balance in healthcare. You can see all practices trying to find different ways of doing it, but just consider the stress that puts on everybody as well.
Mm-hmm.
And so I think our healthcare system, particularly here in Payson, has been amazing at
Mm-hmm.
responding.
Mm-hmm.
But there have been some casualties. There have been some extra stresses. And then honestly, just trying to keep up with, when COVID information changes every single week. Every week we have new information.
Mm-hmm.
Just trying to keep up with that, in addition to having a family and, living the dream in RIM country, doing things like that. It just, boy, there's a whole new layer of challenge that comes with that.
Mm-hmm. Well, I know I am very thankful, and I know there are many, many others in our community that are very thankful for you, your staff, all of the healthcare workers in Payson and RIM country, and just the tremendous effort. And like you said, it's great to see the different organizations and groups coming together and working together, doing whatever they can to help each other in this situation.
Well, and that's where some of the leadership that you see, for example, I was really proud to be a part of what Banner Payson was doing, and I'm very pleased to work with Hoyt Scabland and Cynthia Booth and the leadership there. But even within our organizations, we see the stress, and we see how are we managing today, and then you're simply trying to have organizational meetings, and you find that certain practitioners are running late, so it's hard to even vote on different important items, and there's all kinds of challenges, and yet everybody is giving it their best. But how long can you keep doing that? It's a marathon. It's not a sprint.
Yes, and wow, and just like that, half an hour is gone. And I mean, there's so many other things that we could talk about, but hopefully everyone listening was able to get some good information, and it was great information that was put out there today. And again, antibody testing. If you want to, get tested for antibodies,
See your healthcare practitioner. Or I don't know if that's something that the laboratories will allow you to do certain routine tests. If you're having a cholesterol problem, they allow you to get your cholesterol checked. There's certain things that are more routine.
Gotcha.
The antibodies, that could be a very expensive test. So I imagine the healthcare insurance plays a role in that, and so you probably need to meet with your practitioner and talk through why are you at increased risk, and if you do or don't have antibodies, how does that influence your decisions? And in general, we've been promoting the vaccines. One of the populations that we're really concerned about is, are we getting everyone in the younger age groups? We have people that are contracting COVID and having terrible reactions to it. Some of them are in their 30s right now. And so, wow, I've had patients in my practice. We've lost people in their 40s, in their 50s, in their 60s, certainly in the more advanced age groups as well. But it's affected all of us. And so it's like, oh, wow, we want to do all we can to protect people. And then you mentioned about the oral medications. There's new things coming out with regard to that, and concerns of how it's metabolized in your liver and in your body systems. And different conditions where you need to be more sensitive, like renal disease. You need to be working with your healthcare practitioner. Probably best to have a well check and discuss some of these things, and make sure that you're keeping close tabs with your practitioners these days.
That is good. All good information. And tomorrow we're going to have Donovan Christian and Sarah Lee on to talk about the group and kind of I guess the movement that they kind of got behind to encourage healthcare workers, and they were caroling outside of Banner last week before Christmas, and they have some other events or ideas or things that they're going to do to encourage our healthcare workers in the community. So it'll be great to hear from them. And I'll also reach out to the Gila County Health Department, because I'm not sure if they're still providing the antibody tests in Payson, if they're doing that anymore, or because I know.
Well, and there's two different tests, as you mentioned. That is there the presence of antibody. Okay, you've got some degree of protection, and how much antibody. That's a little more expensive, a little more elaborate test, and I'm sure the healthcare system doesn't want to. I don't know what that costs, but I'm sure a couple $100. But I don't think they want to do that on everybody and multiple times a year, and so you can run into situations like that. And,
that's right.
Yeah,
I remember, because we did get tested for antibodies, but like you said, it was just for the presence. Yeah, so it would be good to know the levels. That is important.
Yeah, well, and worldwide, you're starting to see that. You're starting to see differences, and even on the news last night, I was hearing that even some of the professional sports organizations are no longer separating the people who have been vaccinated versus those who have natural immunity, but they're trying to make sure everybody is protected nonetheless. And so you can see organizations beginning to play a role in this and saying, okay, how do we keep our population safe? And worldwide, you see that in Germany, for example, people with natural immunity, they're saying, well, how much antibody do you have? It's the best measure that we have of, are you protected, or are you likely to spread this to others? And so there are things like that are happening. In our country, we're still working on vaccine, the recommendations to take vaccines, and trying to make sure that everybody has a head start on their immune system. Okay, and different populations need that more than others, and so we've been trying to learn from that. I've had people that have leukemia and lymphoma, and some of those people have to get 4 full vaccinations. But the studies are now showing. Now it took a while to get those studies. Those studies are now showing, that's the first point in which they really got protected. Oh my goodness, wow, what big news, So then it takes kind of the politics out of it and says, what does it take for me in my conditions to be protected?
Each individual. So, that is good. Well, thank you again, Dr. Michaels, and thank you everyone for tuning in and also watching on Facebook and YouTube. A lot of people checking in today, and hopefully you got some great information. And again, we really appreciate you coming in today, Dr. Michaels.
Thank you. Yeah, and I just mentioned, drop that number, Ponderosa Family Care, 928-468-8603. I believe it's still option number 3, but listen carefully to the options as they change. And trying to get anybody COVID care that needs that. We do testing, monoclonal antibodies. We're doing all we can to try and help our community with vaccinations. We're trying to play a strong role in that, and we know those things will change over time, so keep reading, keep aware.
There we go. Again, that's Ponderosa Family Care, 928-468-8603.
Yeah, and it had been option 3, but listen to the options carefully.
Okay. Well, thank you again, and a big thank you to Desert Financial Credit Union for sponsoring our Community Spotlight program. And now it's time for a update on the weather from the National Weather Service.
Now here's the KRIM weather forecast for Payson and surrounding areas. I'm nowcast meteorologist Joe.
There we go. All right, that was good. Yeah, that was quick. Oh my gosh, it just goes so fast.
It does, yeah.
Turn